Hey everybody, welcome to Surface Level, curious conversations about the Black and queer experience. I'm one of your hosts, Tony, and today, Jordan, Damon, and I are discussing sexual hygiene and how to have better, more pleasurable sex. I'm going to say a word that's related to the topic that we're discussing today, sex ed, and I want you all to just say the first thing that comes to your mind, hygiene.
Necessary.
Clean.
Important.
I love it. And so we're going to go a little hygiene, and then we're going to get into some more pleasurable conversation. And then lastly, we're going to end with medical so the girls can have their information and stay safe. Douche.
Sometimes.
Several times.
Clear it out. Some of the preparation actually should happen through the foods that we're eating every day.
Group sex.
Sign me up.
I'm good.
Curious.
There are two sphincters. So there's the external and the internal sphincter.
And finally, sex ed.
Necessary.
Time.
Needed.
This is sex ed. We are in the classroom.
We are finally
We made
in
it
the
back.
classroom.
We're
Class
going back to school.
Is in session. You know, this episode I can't wait to get into because there was such a big deal made out of when we had Jihad JC, our niece, on the show last season. Or it was actually like a little special 3-part Earth, Wind, and
Bonus.
2-part
Yeah.
bonus.
It was a Make Me Water episode, and we got into talking about sex and different things like that. And I think the aspect of douching came up.
Yeah.
Yeah, like on the fly though.
On
like
the
not
fly.
part of the
And
conversation.
he had
as
to
we were-
leave. It was a hard stop.
Right.
It was like and a matter of fact, before we all leave the
Right.
studio,
Yeah.
what about X, Y, and Z? It's just like
Yeah.
we
Not today, baby.
we gotta wrap
he
the
was
episode
confused
up.
about something that we were basically like, we can talk to you about that off camera after we're done recording this conversation. And there was some giggling happening, and his following, which they are ruthless. They can be ruthless. They're a lot of fun, but they were ruthless to us because they felt we were making fun. They felt like we didn't take that as a learning opportunity to show him the light.
What they gonna learn today?
They gonna
I
learn
really
today.
didn't know the answer. And what we always try to do on this podcast is make sure that if we're talking about a matter of a fact, to know what we're talking about and to do some research before it.
Yeah.
I don't know if you should be douching on your back or not. Like, I would want to do
knew
some
that.
research.
You knew good goddamn well.
I would want to
Now
do
we
some-
just lying. Tony wrote the
No,
tape. Let's
seriously,
move
like,
on.
listen.
Like, why wouldn't
know
you
what?
douche on your back? I mean, I thought it was. I giggled when I heard it because I'm just like, I haven't heard of that before. But maybe it's something scientific about it. I'm not the one to say though.
That's not my method. But today, I'm really happy because this episode is going to be brought to our listeners by Surface Level High, because we are now opening in high school where sex ed will be taught.
Yes.
And today we have a guest that is an expert on the subject matter, which I'm really happy about, because when it comes to that medical stuff, don't get me to lying. I can tell you what I know, but don't get me to lying. So let me introduce our guest today. So today's guest is not only the ultimate doctor, but he's also the ultimate guy of 2024, as crowned by Men's Health magazine, and has an extraordinary story. So after a near-death experience during a routine surgery in January 2023, he emerged stronger, dedicating his life to saving others as the medical director for clinic services at the Los Angeles County Department of Public Health. But that's not all. He's also a member of the United States Presidential Advisory Council on HIV/AIDS, advocating tirelessly for those affected. And when it comes to health advice, whether it's tips for healthier living or the best foods and practices for bottoming for you girls,
Oh,
and me sometimes too.
don't shame me.
No, for me too, because I like to bottom.
For us girlfriends.
For us girlfriends, he's the guy you want to have on your side. So today we welcome Dr. Leo Moore to our Surface Level family.
Thanks for having me.
Dr. Moore, I just want to let you know, and for our listeners who may be just tuning in for the first time this season, that this season is titled Throb, and it's all about sex. And today we have a riveting conversation. We're going to get down to the basics. We're going to have some sex education up in here. Honestly, our listeners have been biting at the bit. Chopping at the bit for this topic today. So before we go deeper, let's stay on the surface level with a little word association. So I'm going to say a word that's related to the topic that we're discussing today, sex ed. And I want you all to just say the first thing that comes to your mind. It can be one word, 2 words, 3 words, not a sentence. So I'm going to start. We're going to go Damon, Jordan, and Dr. Moore. Hygiene.
Necessary.
Clean.
Dr. Moore.
Important.
I was going to say important too. Butt sex.
Fun.
Yay.
Riveting.
I love it.
Work.
Douche.
Sometimes.
Several times back to back.
Clear it out.
And necessary. Poppers. Damon.
Big fun.
Ecstasy.
Dr. Moore.
Concerning.
Open. Lube.
Necessary.
Glide.
Lots of it.
Slippery. Sex toys.
Maybe.
Vibrate.
Can be fun.
Sometimes. Group sex.
Sign me up.
Eek.
I'm good.
Curious. Prep.
Prescription.
Yes.
Dr. Moore.
Prevention.
Maybe, maybe not. Masturbation.
Every day.
All the time.
Surge in testosterone.
All right.
Here and there. And finally, sex ed.
Necessary.
Jordan.
Time to do it.
Needed.
Yes, I was going to say we need more sex ed. And finally, for you, Dr. Moore, we asked this to all of our guests. We want to know what you're curious about.
I'm really curious about questions that Black queer people have around sex. So that's why I'm so excited about this conversation, because there's a lot of misinformation. And so I'm curious about what are the questions that people have and making sure that they're getting the answers.
Nice. And we're going to get some answers today.
All right. We got a long list.
So let's jump in. I have split this conversation up in 3 ways. And so we're going to go a little hygiene, and then we're going to get into some more pleasurable conversation. And then lastly, we're going to end with medical so the girls can have their information and stay safe. So let's start with hygiene. Dr. Moore, what tips or information can you share about how to properly douche? This is kind of, I think, what the impetus of the conversation came from with the guest that we had.
I did, yeah.
In which, you know, it was Jihad from Hopeless Romantic Society, and his followers literally tried to read us into a box because we didn't go into more detail on telling him how to douche. So we would like to know, and I mean, I think these girls know, but maybe we don't know how to do it properly. So if you could inform us on how to properly douche, what are some tips, best practices?
Great question. So first, I want to step back a little bit from douching and reframe to preparing for anal sex. And the reason I say that is that some of the preparation actually should happen through the foods that we're eating every day. And so it's so important for folks who are bottoming and those who aren't bottoming, quite frankly, to be eating a high fiber diet. And we know that Americans across the board aren't eating enough fiber. For people who are born male, they should be eating about 30 to 38 grams of fiber a day. Most of us are eating about half of that. So, ensuring that we're having enough fiber. The next thing I'll say is avoiding foods like red meat, dairy, as well as a lot of caffeine before preparing to have sex. We know that red meat is really, really viscous, so it's really hard for the body to break down. It can actually take anywhere between 2 and 6 hours to break down and process red meat. Dairy, particularly like cheeses, it can take up to 72 hours to completely break that down. And so when you think about dairy, think about mucus production, because it creates a lot of mucus in the digestive tract. So then, you get extra mucus that's coming out during sex, which nobody wants that. And then when we think about caffeine, it can give you the runs because it can cause more contractions in the GI tract. So what you're eating is really, really important. All right, so now to get to douching itself. The first thing I want you to think about when it comes to douching is what you're going to use to douche. So either an anal douche bulb or using a Fleet enema bottle. And next, I want you to think about the type of solution that you will use. So the only two solutions that I recommend are water, warm water, not hot water, but warm water, or a normal saline solution, so a saltwater solution. And the Fleet Enema brand actually has a saline version. So I recommend using the saline actually over tap water, because what we know about saline is that, it mimics the composition of the fluids in the body. And so it can keep your anus and rectal area from getting off balance from an electrolyte perspective. So really we recommend the saltwater mixture. So let's say that a person doesn't have a Fleet Enema bottle and they're just using a regular anal douche bulb. They can take 1 teaspoon of salt, mix that with water, warm it up, mix it together, and they have a normal saline solution. So putting that solution into the bulb, putting the bulb 2/3 up into the anal canal, and then gently squeezing some of that solution into the anus. And then tightening the anus, holding it in, and then releasing that fluid. And they want to continue and repeat that process until the fluid is clear. So that is the process for douching. That is the safest process. I want to make sure that people are aware to avoid using any alcohol. I've even heard of people trying to use bleach. Anything that's acidic should not be used on that tissue, on that anal tissue. And the reason that I mentioned warm water instead of hot water is that we want to keep in mind that the tissues inside of our body, particularly in our GI tract, are a lot more sensitive to temperature than our external skin.
That was very thorough.
Total boiling
Indeed.
your guts up.
Yeah, I think that a lot of people, there's some things I heard for the first time I think were new to me in terms of that saline solution and the Fleet brand having an option that, people say don't use that, but there is an option you can use. and also just knowing what the impact is that certain foods have on your, I guess, digestive system. Because a lot of that, like the cheeses and the coffees and the meats of it all, and how long they take to break down. And
I ingest those every day.
She's going to a steak dinner,
A coffee,
have an espresso at the end of the dinner.
I do have espresso.
Not a fibrous vegetable in sight.
But did Dr. Moore, did you mention the foods that are high in fiber, or if there's fiber supplements that you would recommend?
So I didn't mention, but the foods that are high in fiber, one thing to know about fiber is there is no fiber in animal products, no fiber in seafood. So your fiber is going to be in your plant-based foods. So a lot of fiber in beans, a lot of fiber in peas, nuts, seeds, a lot of fiber in fruits as well. Think about your apples. And a lot of the fiber in fruits is actually in the peel of the fruit. So in an apple, in a kiwi, which people don't tend to think about, but with kiwi, you should be eating the peel as well. The peel actually has the majority of the fiber in it. And although fiber supplements exist and they have their place, I recommend that people actually eat their fiber. And the reason for that is that in our gut and our digestive system, there are trillions of bacteria, fungi, and viruses that help our bodies digest food. And that's called the gut microbiome. And what we're finding is that our gut microbiome is so important in regards to preventing obesity, heart disease, cancers, even Alzheimer's, dementia. And so the fiber that you consume helps those good bacteria to flourish in the GI tract. You won't get that from the fiber supplements, but having a diverse array of foods that you're eating that are high fiber will help those good bacteria and other gut microbes to flourish and help to prevent those diseases.
Well, that's inspiring. I think I'll spend more time in the grocery store.
If I come into your house and you are biting into a kiwi, I'm still gonna think you're a murderer. I'm just saying that hairy
What was you
fruit.
doing with the kiwi before?
You cut it in half. Most people cut it in half and eat it with a spoon. You've eaten kiwi fur.
But Dr. Moore is saying you can eat the skin.
I've
You
never
can definitely
seen
eat the
anybody-
skin. So if it helps Damon, then they can just cut it into slices and just
I've
consume
never
the
seen anybody eat
slices.
no
Will that
kiwi
make them
skin.
still a murderer or no?
And he's come from Jordan and her family. Murderers.
Murderers. So as it relates to hygiene, because I want to get on this BO situation. And some people sweat more. Some people carry odors differently. I like to smell like my natural self, but I also, in the summertime especially, can sweat a lot. So there are products that I've found. It's actually a Black-owned product. I forget the name off the top of my head that I have used from time to time that you put in your genital area. You let it sit for like, I don't know, 5 minutes or so, and then you take your shower, and literally you can go all day long. You can put it under your armpits, I think between your booty cheeks, and like go all day long and literally be like, girl, I smell like brand new.
Mm-hmm.
And so I want to know, and maybe Damon and Jordan, if you have any tips and tricks that you've used or are aware of, but I would like to discuss how can we maintain and manage healthy body odor. Yeah.
Great question. So, I mean, I would say one of the most important things is, of course, washing regularly and then utilizing antiperspirants as well. One thing to think about with a body odor is that sometimes the body odor, if it's different from the usual body odor, can be a sign of an actual STI as well. So if we're talking about like the genital area and there's a new body odor, that is one thing that, you want to keep in mind is to kind of inspect the area, see if there is any new discharge, any new sores, things like that. But aside from that, ensuring that people are regularly like washing, regularly using antiperspirants.
Well, when we think about antiperspirants, because I think most people think about this under the armpits, but downstairs too. Yes.
So yes, for downstairs, some people actually use powders as well, but I would not recommend any powders with talc in them. We know that there have been a lot of issues with those powders and being associated with cancers as well. Another thing to keep in mind to prevent a lot of buildup of sweat in those areas is monitoring the amount of hair that's there as well, and trimming as well, because hair also holds on to moisture and holds on to odor. So that's another thing just to keep in mind, is one way to, keep down that body odor is to shave or to, lightly shave. And I would say not to always shave so close to the skin, because it does increase the risk of folliculitis and other, hair bumps as well, and chafing, all those things.
Yeah.
So
those would be my recommendations.
For the girls that like to go on au natural, just trim it down a little bit. It don't have to be to the skin, but
I don't want anything natural. Don't make the sense natural.
Don't make the
have
sense
hair
natural.
Everything needs maintenance.
everything needs a little touch up.
A little tune up.
Yeah. Well, let's talk about pleasure and the slipperiness of it all as it relates to lubricants, and in which everybody should be using lube. That's a PSA announcement. But I want to know which lubes to use for which occasions. So if you're going to be participating in anal sex versus masturbation versus using toys? Are there different lubes that we should be keeping in mind when we are participating across those different avenues?
Great question. So what I'll say about lubes is it's really important to think about if you want the lube to last longer. So silicone lube tends to last longer without needing repeat applications, whereas water-based lubes do need more frequent applications. So that's one thing to think about. Also, depending on the type of toy that you're using, there may be a recommendation for a water-based lube versus a silicone-based lube as well. But for your general, like dildos, beads, things like that, it's usually whichever type of lube you prefer. I don't recommend the use of lubes that, such as different coconut oils and things like that, because they can actually irritate the lining, of the GI tract, and the friction of sexual intercourse can actually also heat those oils up, which could irritate the lining as well. So, use the over-the-counter lubes, I would say, are better for the body because we know they're not going to heat up during the friction of sex.
Over-the-counter lubes, which I don't think I've bought a lube over-the-counter.
You have it?
They're all over the
Oh, I'm like over-the-counter. I'm thinking about in the back pharmacy.
No, that's prescription.
Oh, is it prescription lube?
Right.
Well, I have a question. I have a follow-up question about lube. What are your thoughts about lubes that have numbing properties in it? I've also seen, I don't know if they're called lubes, but I think it's a brand called Boy Butter or something like that.
I've heard of that.
That like creates extra
sauce.
right action. So I'm just curious what your thoughts are about those two things, the numbing and then I guess the non-lube butter type of.
Mm-hmm.
Yeah.
So I'll say for the numbing, I'll be honest, I have concerns about numbing creams because when you numb the area, you're not as quickly able to identify when you may actually be having trauma in that area, because you can't feel as much. And so, I tend to kind of caution away from those or, tell people just to kind of be mindful and maybe check themselves because sometimes sex can get really vigorous and rough and there, maybe some tearing or some bleeding that's happening that you may not readily feel because you have that numbing cream there. And we also have to really think about the fistulas that can also happen and the tears that can happen, with the muscles of the butt as well and wanting to prevent those. So that's my thought on numbing creams. As far as the butters are concerned, I will say with those, we just want to also be kind of cautious about what is included in them, because as I mentioned about the saline water earlier in our conversation, you want to just make sure that these body butters aren't going to throw off the chemistry in the buttocks area and in the anal canal.
Speaking of the buttocks area and anal canal, I want to talk about the prostate, and that's, I guess, considered the male G spot. And so,
I heard of that, yeah.
what can happen if you are able to locate it and find it and engage with it?
I thought you had the answer to that already.
I don't. Well, for our listeners, Dr. Moore, can you just expound a little bit more on that prostate, that male G spot, once it's located and stimulated?
Once they press the button.
Once they push the button, what is possible?
Well, I think I'll start with sharing with folks what the prostate is, where it's located as well.
Okay.
So the prostate is a walnut-shaped gland. It's directly below the bladder. It kind of wraps around the urethra. So that's the tube that takes urine from the bladder, out through the penis. And it includes production of seminal fluid. So the fluid that kind of mixes with sperm and is ejaculated. So we also call it the P spot as well. So male G spot or the P spot. And one thing that we know about it is that it has a lot of blood vessels around it and a lot of nerves. And so, it's actually very sensitive and can be pleasurable to directly stimulate. So how folks can stimulate it. If your partner is laying on their back, then you can insert your fingers about 2/3 inches in and then press upward. And you can press upward multiple ways. You can circle. You can do like a come hither. And you can also massage it to the point that it actually excretes some of that milky fluid that would be a part of ejaculate as well. So those are a few ways to stimulate it with the fingers. One thing that I like to mention to those who are participating in anal play is keeping in mind that there are two sphincters. So there's the external and the internal sphincter. The external sphincter, we have control over that with our bodies. You can contract it. That's the part of Kegling that's being done where you're contracting, contracting, relaxing, contracting, relaxing. And then there is the internal anal sphincter, and that is more so controlled by the body and by our nervous system. So when entering a person with fingers, toys, or the penis, you want to apply pressure in that area, gentle pressure, but enough consistent pressure that internal sphincter will relax and then enter into the person. So when you feel that relaxation, it's actually the internal sphincter reacting to that pressure and then allowing entry.
Yes.
I am so dialed into
Right,
this
'cause
conversation right now.
Jordan, get on the table. Now we're gonna do a descriptive.
Two quick questions though. So when the prostate is being stimulated, I don't have a medical term for this, so I apologize in advance, Dr. Moore. Is that the equivalent of someone creaming? That's my first question. And my second question,
when folks feel like they came out there.
yeah, because I always thought that was a myth.
Mm-hmm.
And then for the second question, that internal sphincter, is that also what people consider the second hole?
Oh.
So those are two great questions. For the creaming aspect, what I'll say is that fluid can be a part of it, but then it's also fluid that's coming out of the glands that are kind of along the anal canal as well. So it can be kind of a mixture of that creates that foaming. And when people are talking about the second hole, they're actually talking about kind of going further past those two sphincters. So when you think about the external and internal canal, think about like two layers of muscle that are together. So you would go past those two layers and then further in, almost to the point in between kind of the entry of the rectum, and you kind of pressing right there. That's where you feel the second hole. So it's further in than right at the entry area for the second hole. And the person actually has to be able to relax to allow someone into the second hole. In order for them to also get pleasure from that. Because otherwise it can just feel like the person is kind of like pounding against a wall, quite frankly, and it can be kind of painful for both partners.
Yes. Damon, you just hearing the description of it, your face is saying, I'm in pain now. Just listening to
my face is saying, yes, wait for people to relax.
Yeah, wait for people to relax.
Don't be trying to run up and
absolutely
through bottoms like.
Yeah, that's when the tops of the world need to handle bottoms with more care. You can't just be running and gunning.
And bottoms handle your own fucking care. Stop.
That too.
Slow down.
You got to be able to speak up.
Stand up.
Close second holes don't get fit.
I want to before we pivot into medical, I'm gonna double dip back to hygiene for a second, because as it relates to douching, there's one thing that came up that we have heard about and that none of us have experience with, but we wanted to talk about whether or not it's safe or not. And it's the medication. I don't even know if it's a medication. It's called Imodium. And so is that something that we hear you take Imodium and it's supposed to keep everything up and stuck inside of you as opposed to letting things out of you? And we said we want things out of us versus like holding things
I don't want
inside.
to hold on to waste.
Is that
And and for clarity, you're talking about as an alternative
as an
to
alternative
douching.
to douching?
Right.
As an alternative to douching. I'm curious about the Imodium. And you're shaking your head. I don't know, Dr. Moore.
I'm shaking my head no about the use of Imodium for that. So let's just first, Imodium, generic name for that is loperamide. Imodium is meant to be used for those who are having diarrhea, either like acute diarrhea, maybe from a stomach bug, what we call a gastroenteritis, or someone who has kind of chronic diarrhea because they have inflammatory bowel disease, or things of that nature. So I don't recommend using it for one main reason. Keeping those things further up can actually cause abdominal cramping. It can cause bloating, and it can cause increased passing of gas, which quite frankly are not your goals, right? During anal sex. So that's one of the reasons. I think honestly, in this day and age, there are a lot of quick fixes that, don't work in the ways that people think they're going to work consistently. The things we talked about earlier, fiber, watching what you eat, and using the douching techniques that were shared, are sufficient to ensure that a person has a pleasurable sexual experience.
Thank you. We needed that. So we talked about hygiene. We talked about pleasure. Let's get into the medical to round this all out. So, Dr. Moore, can you explain the difference to us and our listeners who may not be aware, the difference between PrEP, PEP, and DoxyPEP?
Yes. So we'll start with PrEPs. PrEP stands for pre-exposure prophylaxis, and it's the process of a person taking medication to prevent HIV in the event that they were exposed to HIV. And there are 3 medications available for PrEP currently. One is Truvada. The second one is Descovy. Those are both pills. And then the third one is Apretude. And Apretude is an injectable medication that's taken every 2 months. All 3 of these medications, when taken as prescribed, decrease the risk of HIV transmission by 99% or more. It's like 99.999%. We can never say that anything's 100%, but really, really high when taken as prescribed. The next one is PEP, or post-exposure prophylaxis. So that's the process of taking a medication after exposure to HIV, or even a concern for exposure to HIV. So say it's a random hookup with someone that you aren't aware of their HIV status, and either the condom breaks, or let's be real, the person maybe didn't use a condom at all and then thinks, oh shit, this could be someone who has HIV. I could have put myself at risk for HIV. They can then take these combination of 2 medications within 72 hours, and it reduces the risk of HIV acquisition. So we think that reduction is between 60 and 70%. It's not as high efficiency, but still pretty effective in preventing HIV transmission. And then there's DoxyPEP. So DoxyPEP stands for doxycycline post-exposure prophylaxis. And that's the process of taking doxycycline medication after having sex to prevent STDs. So PrEP and PEP are preventing HIV. Doxycycline is to prevent specifically chlamydia, syphilis, and to a lesser extent, gonorrhea. And why I say to a lesser extent is because the studies showed that in people who were on PrEP, who took doxycycline, they decreased their risk of syphilis and chlamydia by about 80 to 90%, I would say. And then for gonorrhea, it decreased the risk by about 55 to 60%. So big difference there in in the prevention of gonorrhea. So it still can prevent gonorrhea. And if a person has kind of a common strain of gonorrhea, it can prevent it. But it's stronger in prevention of chlamydia and syphilis.
Nice. And this is all information I feel like is super important. I didn't really know about DoxyPEP until maybe about a year ago. And a lot of folks still don't know about it. And so 2 follow-up questions that are tied to that. We want to know, how do people know whether they're a good candidate for any of these medications, and also any adverse effects that folks should be aware of? Because we have friends that are like, I'm not having that much sex, so maybe they've been advised that they shouldn't be on PrEP, for example, because of some of the effects it has that are concerning to them if they're not necessarily having unprotected, inconsistent sex. Right.
Consistently having unprotected sex.
Consistently having unprotected sex. We got it.
Well, I mean, the first thing I'll say about that concern about taking the medication if they're not consistently having sex is there is a way to take Truvada that actually works for those who aren't having sex consistently. It's called 211. So they can take 2 pills up to 2 hours to 24 hours before they have sex. Then they take a pill the day after, and then they take 1 more pill the day after that. And that has pretty strong data around protecting a person from HIV transmission. So that's called event-based PrEP. Or 211, and that is an option for those who are inconsistently having sex, who want to be able to protect themselves from HIV using this method. For understanding who can use these medications for PrEP and PEP, they have to be HIV negative. So they would get an HIV test, at a local clinic or community-based organization, federally qualified health center, etc. So get a test. They also would get STI testing as well, so that any STIs could be treated. We also test kidney function as well, because we have seen with Truvada and to a lesser extent with Descovy that it can cause a minimal decrease in kidney function. And so we monitor the kidneys regularly while a patient is on PrEP as well. And then we also test hepatitis B serology. So that's the test that we use to determine if a person has either been vaccinated against hepatitis B or has acute or chronic hepatitis B. And the reason we do that testing is that Truvada actually works to treat hepatitis B, but in very rare cases, when a person with hepatitis B, particularly those who have like end-stage liver disease, meaning that their liver has become really fibrotic and cirrhosed, those people can have a flare-up of their hepatitis B. So we want to know if a person has hepatitis B because if they stop taking Truvada, they can have a flare-up of their hepatitis B. So those are the tests that we do for a person when they're starting on HIV PrEP and PEP. For DoxyPEP, we test people for STIs before we start them on DoxyPEP because our concern is that if we start them on the medication and they have an STI, then we can create a resistant strain, right? And then it will be harder for that to be treated. The way that I do in my practice is, because many of my patients are on both PrEP and on DoxyPEP, is that once I've tested them for STIs for PrEP, I also can go ahead and refill or fill a prescription for DoxyPEP for them as well. And then every time they're coming back for their testing, then I can refill again. And then if a person runs out of their DoxyPEP, I will have them come back for testing again, and then I give them more DoxyPEP. But that has been kind of my method and the method of my team to try to decrease the chances that we're giving someone this medication to take when they already have an STI.
Yes. Well, this has been a wealth of knowledge.
Yes.
And also brought to you by Surface Level High, because this is now, we're in high school right now. This is the classroom, and class was in session. So Dr. Moore, we really thank you for everything that you just took us through today. through the hygiene of it all, the pleasure of it all, and the medical. And there are going to be probably a lot of follow-up questions, people who want to find you, people who want to find out more information. So if you're willing to share, can you please let people know where they can find that information?
Oh, that's a great question. Where they can find that information. So there's a lot of great information on the CDC website. There's also His Health, which was done by NASTAD a few years ago. So you can search hishealth.org. And then I also regularly post sexual health information and education, and we'll be doing a lot more of that for Pride Month as well. So my IG at Dr. Leo Moore, Dr. Leo Moore. And so would be great to hear from folks if there are any specific questions that they would want me to address as well that I'd be able to address over the next month.
Awesome.
Cool. Thank you. And that's all the time we have this week. If you enjoyed this episode, please let's keep the conversation going. Let us know your thoughts and questions at surfacelevelpodcast.com. And remember, stay curious.